Good day, class. In this video, we are going to introduce cough. Cough is a very common symptom that may relate to upper or lower respiratory tract infection, or may be a consequence of non-infectious conditions, such as asthma, exposure to smoke, aspiration of a foreign body, or other medical conditions such as COPD. Patients all very commonly present with cough, but in Chinese medicine, we see cough as an independent disease. Although cough also may present in the common cold, flu, or pneumonia, fever, these diseases, these categories in Chinese medicine, we're going to highlight the coughing specifically. The causes of cough may be due to exogenous pathogens and endogenous pathogens. But how we understand cough? In the classic texts, it describes that the lung is very similar to the bell. So the bell, in these two images, the lung is very similar to the bell. Cough is the voice of the lung. It's very similar to the sounds from the bell. But how can you make the bell to sounds? There are two reasons, or there are two possible reasons. The wood outside to hit the bell. Another stuff they will stay inside that also can hit the bell. So from these two perspectives, in acupuncture, we think that the bell's the lung. Something from outside may attack the lung. Something from inside also may attack the lung. Both of them will result in the noise, which is the cough, the coughing sound. So what's the something outside? That's the exogenous pathogens, wind coughs, wind heats, or other pathogens. The endogenous pathogens that may be due to the imbalance of yin and yang of organs. So mainly we're going to focus on exogenous and endogenous. Especially for acute coughing, or coughing for a short duration. These are mostly related to the exogenous pathogens. Chronic coughing, most of them are related to the endogenous pathogens. But these two, they can, especially the endogenous pathogens, the chronic coughing may develop from the exogenous pathogens. So the exogenous pathogens result in coughing. If it wasn't healed, it may develop into chronic coughing. The chronic coughing, patient always cough, mild coughing. The onset of acute coughing may be triggered by the invasion of exogenous pathogens. So as you can see, these two are closely related, exogenous and endogenous. After long term, the exogenous may develop into chronic coughing, but the onset or the aggravation of chronic coughing may be triggered by the exogenous pathogens. The wind cold, the wind heat, dryness. Symptom differentiation. Due to exogenous pathogens such as When cold, when heat, dryness, acute onset, itching throat or sore throat, phlegm, fever, aversion to cold, runny nose, body ache. As you can see, these symptoms, some of them are very similar to common cold. So in Chinese medicine, how we diagnose common cold or cough? Sometimes we diagnose both common cold and cough. And also in some situations, it depends on the chief complaint. If this patient presents as severe coughing and mild runny nose or even no runny nose, no aversion to cold, slightly body ache, then we can diagnose as cough. The wind cold attack. This is very similar to the common cold, but the patient will be coughing. So the chief complaint will be coughing. When heat, also coughing. Heat will result in sticky phlegm. Dryness affects the lung. Dry cough without phlegm or less phlegm. Sticky because dryness, there's no fluid. Very difficult to cough out. In the phlegm, sometimes you also can see blood because the dryness may affect the vessels. Dry nose, dry throat, dry stool, scanty urine, thin white coating. Cough due to endogenous pathogens. It depends on which organs that has or have been affected. Due to phlegm and dampness in the lung. We said that the phlegm and dampness, they originally from the spleen, but the lung is a container for the phlegm, and then you can cough out from the lung. So the treatment from this, for the phlegm and dampness, apart from focusing on the lung, we also need to focus on the spleen. That's why in this situation, this patient may present as poor appetite, distending abdomen, pale tongue with white greasy coating, due to the lung and kidney insufficiency. In the basic theory, we introduced that the lung is a kind of very fragile organ. They need moisture. It doesn't have to, it must be moist. The lung and kidney insufficiency may result in dryness, insufficiency, lack of fluid, dry cough with less or no phlegm, even blood in the phlegm, dryness. But in the meantime, the patient will present as some symptoms that are related to insufficiency. Due to spleen and kidney yang deficiency, apart from the coughing, the patient also may present as qi deficiency. Yang deficiency will result in coldness, so cold extremities, edema, difficult urination due to liver fire attack the lung. So this is excess liver fire. Coughing comes and goes, less phlegm because of the fire. The fire can concentrate the phlegm, so it won't be a lot, but will be sticky. You also may have blood. Distending feeding with both sides of the abdomen. Dryness, red of the fire, bitter taste, constipation, red or yellow skin, yellow urine, a red tongue, especially on the sides. While on the tip is the heart. So the liver fire also may affect the heart fire. Thin yellow coating. The treatment principles will depend on the specific syndromes. Exogenous pathogens, mostly acupuncture, reducing technique. Coughing due to endogenous pathogens. For deficiency, we can tonify. For excess, such as the liver fire, we need to reduce. For phlegm and dampness, although these are excess, we need to clear the pathogens. We can use acupuncture, but in the meantime, we have emphasized that where does the phlegm or dampness come from? We need to strengthen the kidney function, the spleen function, to reduce the phlegm and dampness. Due to spleen and kidney yang deficiency, a combination of acupuncture and moxibustion, reinforcing manipulation technique. Yang deficiency will cause internal coldness, so we can use reinforcing and even warm needling technique. Due to yin deficiency, acupuncture with even manipulation technique. Liver fire, acupuncture only, reducing technique. The points, we can focus on the hand tie-in meridian. That's where the lung meridian. Back 2 points, the front mu points. The bladder 13, 肺腧, lung 1, lung 7, lung 9. We're going to focus on the lung meridian. When cold, bladder 12, large intestine 4. So these are, some of them are very similar to the common cold. Kidney 3, kidney 6, dryness. We're going to tonify the kidney. Phlegm and dampness, stomach 36 for spleen, stomach 40 to clear the phlegm. Liver fire, level 2, lung 10. Lung and kidney insufficiency, bladder 23, bladder 43, kidney 3. So some are the back 2 points, some are the yuan source points. Spleen and kidney yang deficiency. Back 2 points. Room 4 can strengthen the yang. We can use a moxibustion on those points. Number 36. Accompanied with chest pain or chest tightness, room 17. And on the side of the chest, GP 34. That's where the gallbladder meridian travels. Dry and itchy throat, kidney 6. That's because the kidney meridian travels through the throat. Blood, lung 6. Lung 6 is a C cleft point. When we studied the C cleft points, we knew that the cleft points can be, lung 6 can be used for coughing blood. Night sweat, heart 6. Edema, spleen 9, spleen 6. That's going to strengthen from the spleen function. For acute coughing or exogenous pathogens, we can apply once or twice a day. Due to endogenous pathogens, every second day. That's the frequency. Other treatment techniques such as skin needle technique, you also can apply on the bladder meridian, because the bladder, the taiyang meridian, the foot taiyang meridian, in charge of the superficial. You will see it start from the inner canthus of the eye all the way to the head, all the way through the back till the foot. So it controls a very big range of the body's superficial. It's also the taiyang. The lung, from the 6th meridian differentiation, this is also the taiyang disease. That's why we also can focus on the taiyang meridian, bladder meridian. So for the skin needling technique or even cupping, you can focus on the bladder meridian on the back. The acupuncture plaster technique. The plaster technique you can apply in the coughing. You also can apply it in asthma, the disease that we are going to study in the next video. You can apply the herbal medicine plaster to the specific points. You can see this 3 to 4 points each time. Origin acupuncture also can be applied. The electrical stimulation may always be applied in acupuncture. Thank you for your attention.